And welcome to the Dr. Bob Show. Have you looked in the mirror and wondered where those wrinkles came from? Maybe you'd like to look about 20 years younger. You wonder if plastic surgery would help, and you wonder what they would do and what kind of results you'd get. We'll be spending most of this show talking about facial plastic surgery. My guest is Dr. Ed Breazeale. Dr. Breazeale is a board-certified plastic surgeon, and he'll be answering our questions. Hello, and I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about brain concussions. What to do about them? Should we allow young athletes to continue playing if they've had a concussion? And are you gaining a little weight and your blood sugar is going a little high? Your doctor tells you you're going to get type 2 diabetes if you don't do something. We'll talk about what you can do and how you can prevent type 2 diabetes. We're talking with Dr. Ed Breazeale, board-certified plastic surgeon, and we're going to be talking about facial plastic surgery. Ed, welcome to the Dr. Bob Show.
Thanks for having me.
Tell me about the eyes. Everybody wants to have really beautiful eyes and good-looking eyes. What are some of the plastic surgery you do with eyes, especially the upper eyelid? What do you do?
The upper eyelid surgery is called a blepharoplasty, which means basically removing the extra skin and the fat from the upper eyelid. And I think it's probably, as far as bang for your buck in plastic surgery, one of the biggest bangs for your buck because it just makes you look fresher, more rested.
My father had skin that came down over the eye, and I've got that same basic thing. And sometimes I look and say, oh, I wonder what it would be like if I was just bright-eyed and bushy-tailed there. What does the blepharoplasty do for the person? Makes their eyes more prominent?
It makes their eyes more prominent, but it also, in the situation of your father, makes the visual field bigger. So instead of having the hooding, all of a sudden the skin's removed and the visual world is bigger to them.
How about the lower eyelid?
Lower eyelid's a little bit different animal in that basically most folks with their lower eyelids have puffy bags under their eyelids. Some of that is congenital or they're born with it. There are other folks in our part of the world with a lot of allergies and have had a lot of swelling up and down through the years. And suddenly you have an excess bag of fat or just skin or both that you might need to remove.
Which is the hardest to do, and which is the best bang for your buck?
Technically speaking, the upper eyelid's easier and more simple. It's just more about skin. The lower eyelid, you have to worry about the healing process in that you don't want to take too much skin and pull the eye down. Okay, so you don't want to make them look too wide-eyed or bug-eyed. So that's the biggest thing you have to be careful with in the lower eyelid.
What's the recovery time on blepharoplasty, the upper eyelid?
If you did your eyelid surgery, you're looking probably somewhere in the 7 to 10 day range. It varies from patient to patient. Some folks swell more than others, some folks bruise more than others. But if you took an average, it's about 7 to 10 days.
And have any trouble blinking or any trouble, or just good as gold?
Usually pretty much good as gold, but you have to be smart about the surgery, particularly in the female patients who want more eyelid to show so that they can put more makeup and make their eyes look prettier. Sure. You don't want to take too much skin away from them. If you do, then you have trouble closing the lid, and that can lead to a lot of eye problems itself.
I imagine like every patient, every eyelid is different, the amount of skin that's there and what you have to do. Is it easy to figure out when you examine somebody what you're going to do?
It is. Oftentimes the most overlooked thing, I think, in plastic surgery of the eyelid is the brow position. So many people have a really heavy brow, so even though you take some skin away, they're still sort of hooded. So many times we want to lift that brow up at the same time you take the skin. So it does require some careful measurement because you don't want to take too much.
Do you have computerized facial appearance where you can take somebody's picture and see what it would be like if you pulled up their brow or something like that?
You can do that to some degree, but I tell you what works the best is an old-fashioned mirror right in front of the patient, and you actually elevate the brow before their eyes and they see what they're going to look like.
Now, how do you elevate the brow? I would take it you have to go up here and pull, or what do you do?
Yeah, I think in my case, in your case, we would have a tough time because we don't have a whole lot of hair to cover the incision.
Mine'd be a lot tougher than yours, Ed.
but long story short is you try to hide the incisions either at the hairline or within the hairline most of the time. And you can do it endoscopically using a scope, or you can do an open procedure where you actually cut and just dissect down, get the brow repositioned, and anchor it either with stitches or sometimes actually with a little screw that we put into the skull.
Do you ever do a brow lift without doing blepharoplasty? Some people get a heavy brow.
There are the occasional patients that present that way. So again, this really gets back to your point of every person is very individualized. So one treatment doesn't fit all. We want to know exactly what that person needs.
If somebody has a lot of wrinkles on their forehead, is it better to lift that brow, or is it better to use Botox or some of the stuff to take the muscles away?
I'm a big fan of Botox because it's non-invasive and it's an outpatient procedure. You come in the office and literally in 5 minutes you can inject the forehead, even the scowl line that's in between your eyes, weaken those muscles. Botox paralyzes the muscle for about a 3 to 4 month period, and it does have to be repeated. That's the disadvantage. The disadvantage of surgery, though, is usually a big scar across your brow and a permanent appearance. So that surgeon better do a really good job, or you're going to look very wide-eyed for the rest of your life.
Let's flip to the nose. People have noses that they don't like. A lot of times, I wish my nose didn't look like this. They've either got a hump on the nose, or a flat nose, or a broad nose, or a skinny nose. Tell me about the nose problems and what you can do for those.
Yeah, nose surgery is actually very common. I think it's more common in other parts of the country where there are more ethnic noses per se. But the biggest thing that people ask is about the bump on their nose. Maybe they broke their nose as a kid playing sports. Maybe they just were born with that. And that's where you step in and think about rhinoplasty, where you're actually shaving down some of the bone and cartilage on top to take the hump out.
How do you approach that? You approach it from inside the nose, or do you make an incision here and shave down? Where?
Definitely from the inside of the nose.
From the inside.
So we try to hide the incision to the best of our ability, and it's well hidden inside the nasal vault, if you would. And we go in there and use our little devices and tools and do our work.
I've seen some pictures of people that have the big hump on the nose and they get it fixed. Is it an easy, moderately hard, or really hard procedure?
It depends on the size of the bump. If somebody has a very small minor bump, just going in and rasping that down with a file basically. The other folks who have the big large humps, sometimes you have to chisel away the bone and the cartilage with sharp objects. It can be challenging on some and easy on others.
I would think the results that you get, spending time in fixing that, though, would be really very, very nice for the patient.
They are. Patients, it's interesting, a nose is really part of your personality, and so we don't want to change them dramatically. Think of Michael Jackson, for instance. But we just want them to look better, be happy without the bump. If they need to narrow the nose, we can actually infracture bones. There are many things you can do with the nose, but you have to really understand what the patient particularly wants.
We're talking with Pam Hamby. Pam, welcome to the Dr. Bob Show.
Thank you.
Now, you've worked with plastic surgeons. We're talking about keeping pretty above the face.
Yes.
Are creams important?
Yes, very important. 3 basic ingredients, I think, Dr. Bob, that everyone should have in their daily skincare routine. A great sunscreen.
Sunscreen?
Use it every morning, cloudy or sunny.
The bottle of youth?
The bottle of youth.
And then keep going.
Yes, eye cream. Eye cream is very effective.
Now, does eye cream really work?
Yes,
What does
it's
it do?
specially designed for the very thin skin there under your eye.
Okay.
Yes.
So now we got an eye cream.
Really moisturizing and hydrating. And then the retinol. A retinol product is a vitamin A derivative, and it really helps smooth the skin. It helps decrease the discolorations.
And so you have to use it every single day, all of these creams?
Yes, typically. They various different percentages of the retinol, so that would depend on that.
Tell me what you would do for lines here at the cheeks, and for lines around the lips.
fillers, the gel fillers on the market are great for those areas.
What's the name you want?
Juvederm XC is probably
what
the
do you
most.
do with it?
Fill it right here in the what we call the nasolabial folds or the parentheses. It's very effective there. In the marionette lines here.
Little lines in the cheek and get rid of those?
Yes.
How about the upper lip?
Yes. Those vertical lines that women hate, the lipstick bleed lines, very effective there.
How often do you have to repeat the procedure?
They usually say about once every year. It will last up to a year.
Now tell me about Botox.
Botox is fabulous.
Tell me about it. I've heard of Botox parties. Tell me about
Yes,
Botox.
yes. Botox is very effective for this area here. You will often hear it
Yeah,
referred to as the 11, yes. And then the forehead around the crow's feet, smooths, virtually eliminates the lines that are there.
So when somebody comes in and they say, can you fix this, can you fix this, without surgery, you can use creams?
You can use creams, and then with the other non-invasive, products that we just talked about, the Botox and Juvederm, I mean, they're fabulous options for patients if they don't or are not ready for the surgery.
I think that's great. Pam Henry, thanks for coming and tell us about, there are creams and there are fillers and there's Botox. There's so much we can do before we get to the operating room.
Yes.
Thanks for coming.
You're welcome.
We're talking with Dr. Ed Breazeale, board certified plastic surgeon. We've been talking about blepharoplasty, about fixing the eyes, the upper lids and the lower lids, and then brow lifts, and we got to talking about lips after we talked about fixing the nose. Let's go back to the lip. Tell me about how women get a fuller lip and what it feels like when you touch it.
Right. Back in the older days, collagen injections were in vogue and very popular at that time, but the problem with collagen was it didn't last very long. So patients were having to come back very frequently, once every 4 to 6 weeks, to keep their lips plump. Now we have the ability to use longer lasting injectables. One of them is called Juvederm. It's hyaluronic acid, which is actually in our joints, if you would, so it's a human product that's genetically engineered, and it sticks around for about 9 months to a year. So that's what we inject.
My lips are sensitive. How do you inject into the lip? You just put some numbing stuff and just inject it?
We do some topical cream, and interestingly now, through the years, they've refined the product to include lidocaine, which is numbing medicine within the product. So aside from that initial little poke that you feel, little bee sting, it really doesn't hurt very much anymore, and patients do really wonderfully with it.
How do you know how much to inject, and if you don't want to get too full, but you want certainly the person to get a bang for their buck?
There is a little bit of an art form to it. I think you have to have the eye for how much to inject, how much not to inject.
Yeah.
You have to know where to inject, more importantly. A lot of gals will have some fine wrinkles right at the lip line that they don't like, and maybe their lip's not quite as full. So you'll build up this border of the lip where the pink meets the white. That's called the vermilion border. And you inject the vermilion, and then you assess whether they need more injected into the plump pink part of the lip as well.
What does the Juvederm feel like? Is it nice old soft old stuff?
It is nice and soft, and that's what's great about hyaluronic acid. It's almost a gel consistency to it. So if you put it on your finger, it would be very slick and very smooth feeling.
So kissing, puckering your lips, moving your lips around would feel very natural.
It's very natural, and that's the beauty of the hyaluronic acid being a product that's derived from humans. Yeah. It's very well tolerated in the tissue.
How long does it last?
About 9 to 12 months, depending on the patient. That has to do with the patient's metabolism, how wired they are, how fast they eat the product up. But most gals are very happy to get 9 to 12 months out of the injections, and that's about the typical time.
Let's go to a facelift. Now, you hear the word facelift.
Yeah, it's scary.
What do you do with a facelift? What does that mean?
A facelift really is not as simple as it sounds. Most folks think of lifting a face and pulling somebody really tight, and they conjure up bad images that they've seen of some of the stars out there who've gotten some strange looks. Really what you're interested in doing is not only removing some of the loose skin, but the real work of the facelift is done underneath, where we want to reposition fat pads, where we want to tighten muscles of the neck, and then take the extra skin away. So we're not depending on that skin to pull that face tight. We're depending on redoing and repositioning. That's right.
Now, if it's a facelift, is it from here down, or is it from here up, or where are you lifting? Or where are you working under the skin?
That's often confused. Facelifting per se is really the middle part of your face here and your neck. So this lower 2/3 of what you see is a facelift. This is all brow and eyes up here.
Where do you make the incision?
Incision for the facelift, we try to hide them as well as possible. We follow the contours of the ear, okay, around the front, and then we go into the temple up here so we can get some pull in this direction, pull this direction into the ear, and then the seam, if you would. I'm nothing but a glorified seamstress. we're going behind the ear and then back along or within the hairline. So everything is being shifted backwards and lifted up. So we have to have a seam just like a suit maker or a seamstress would have a seam.
The suture in itself, is it a real fine suture? How do you know, where does the expertise come in making that incision so fine where it's hard to see later on?
I think it's incision placement is key, number one. You mentioned that. The number two thing is how you stitch the underlying tissue. And we use dissolvable sutures that are in the dermis of the skin or just underneath the surface that are the holding sutures. They really give you the strength. And then the stitches on top of the skin, the really fine sutures, are just put in more or less just as a security layer for us.
In the face, if I try and lose too much weight, I get sunken right in here, and I call it a skeletoid look right there. And what do you do in people that have sunken in cheeks right here?
Yeah, I think number one, you try to get them to gain a little weight back. But number two is more often than not, the loss of volume that you have in the middle of your face is because the fat pads of the face have descended or fallen. Well, if you reposition that fat pad up into its appropriate spot, you get a lot of that volume back into the cheek area.
You see a lot of people with little, we used to call them jowls.
Jowls, yeah, absolutely.
Right here, and so is that the fat that's falling?
That fat pad falls down, and that's, as we mentioned a bit earlier, that's part of the deep work that you want to do in the face. Now, there are some people who need more fat, so you can do fat transfers now where you actually steal fat from one area of the body and inject it into this area. There are also cheek implants that you can put in if somebody wants a really full cheek. But you have to choose those people very carefully because you, again, don't want that overdone look. We want a really nice natural look. I'm interested in making the patient look 10, 12 years better. Okay, that's it. I don't want them to look like somebody else.
How about the little, what do you call the little skin that falls down under the chin?
I think I call it a turkey gobbler.
Yeah.
A lot of folks in this part of the country call it that. And that's a combination of a couple of things. Sometimes it's extra fat. Sometimes, again, it's about the bands in the neck. You can see the bands that happen. The muscles in the neck loosen as we age. So those two things combined, a little extra fat, little loose muscle, all of a sudden loose skin, you've got the turkey gobbler.
Pretty easy to fix?
I wouldn't call it easy, but it's part of the facelift, so it works out very well.
Good. And so with the facelift, you can manipulate fat, you can redesign where you look about 10 or 12 years younger.
That's the goal.
And get rid of the turkey gobbler.
Pretty good day, yeah.
Breazeale, you're a great teacher. Thank you so much for coming to the Dr. Bob Show. I've just enjoyed this so very, very much, and it's nice to see you again.
Well, I thoroughly enjoyed it, and thank you very much.
Great show. You're going to want to stay tuned. We're going to be talking about concussions. Too many young athletes, people that are not even athletes getting concussions, what to do about that. And are you getting a little bit of overweight and your blood sugar going too high? We can prevent type 2 diabetes, but we have to do certain work ethics to get rid of it. You'll want to stay tuned. I want to thank Dr. Ed Breazeale, board certified plastic surgeon, for facial plastic surgery discussion. A lot of information for you and me. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. There's a 15-year-old in my family who was playing football and had a concussion. Should we have him stop playing football? Well, sports are getting more violent. There's more contact in every age group, all the way down to biddy football, to high school football, college football, professional football, and we're talking about football. But what about other sports? One of the leading causes of concussion is ladies soccer. And so in all athletics, we have the potential of getting a concussion. Now, concussions are usually when there's rotational contact. So somebody's hit on the side and they push the head aside very, very fast. It's the rotational part that seems to cause problem. The brain is under the skull and it's bathed in fluid, cerebrospinal fluid, and that protects the brain. It keeps it from being damaged or some blow for causing problems. But blows such as sudden movement of the head, automobile accident, getting hit on the head, bicycle accident. Now, what are the symptoms? Headache's the most common, dizziness, just can't think good, shake your head, not making good decisions, don't react well. Those are symptoms of a concussion that we have. Some people will have retrograde amnesia. They'll actually lose their memory for 6 to 8 hours before they had the contact. Some people lose consciousness. You can have a concussion without losing consciousness. Now, we know from looking at autopsies of people that have had repeated concussions that there can be damage that's done to the brain. Usually for a period of 7 to 10 days after a concussion, we tell people they shouldn't be reading, thinking, going to school, doing mental activity or physical activity for 7 to 10 days. We have to let the brain readjust. What's happened inside the brain? The cells, we call them axons, when they're stretched, there gets to be some fluid. Potassium actually comes out of those cells and they begin to lose their ability to function well. So we have to give the brain time to rest. If a 15-year-old has a concussion, should they be allowed to continue to play football or that contact sport? Well, that's a decision that the doctor has to make. I think if a child has a concussion, then they need to work that out with their doctor and with a neurologist and make sure that the central nervous system function is back to normal before they go back again. Too often, I think we try and throw it to the side and people will have repeated concussions. Once you have one, it's easier to get the next one, it seems to be. Be very, very careful. If you've had a concussion, think about the rest of your life. Question number two, Dr. Bob, my doctor says if I don't watch it, I'm going to get type 2 diabetes. He says I've gained weight, my blood pressure is going up, and my blood sugar is going up. Well, type 2 diabetes is insulin resistance. Almost every food that we eat is metabolized, part of it, into glucose, into sugar. And that sugar goes into the cell, and the cell then uses that sugar for energy. Now, the sugar gets in the cell by insulin that helps it get in there, and that's the key. People become insulin resistant. So they eat the food, part of it's metabolized to sugar, it goes to the cell, but it can't get in the cell because of insulin resistance. What causes insulin resistance? Insulin is made by the pancreas. We know that as people gain weight, they become insulin resistant. And so there is a correlation between people gaining weight and their blood sugar going high and having insulin resistance. Now, if you get type 2 diabetes, then you start having the problems with blood vessel diseases, where the most common cause of chronic kidney failure, heart disease, strokes. It's a very, very serious problem. So if you're gaining weight and your blood sugar is going where your doctor says pre-diabetes, there are some things that we can do, and they're logical. You've got to start eating less and exercising more. And just brisk walking for 30 minutes. You don't have to go very far to walk 30 minutes. And you do 30 minutes and you can do it 5 days a week. You can do it Monday, Tuesday, Thursday, Friday, and Saturday or Sunday, 5 days a week, and get out there and walk. It'd be better if you have a friend because you'll have to be there in order to do that exercising. Or get out of bed first thing in the morning and go do your exercise, your walking. Eat properly, less fatty foods, better fruits, vegetables, Mediterranean diet. It's all the time that we have for this show. Hope you've enjoyed it as much as I have. Remember, exercise, something we've got to be doing every day. Not only will it help prevent type 2 diabetes, but it will reduce stress, it will reduce your blood pressure, it'll get rid of some of the salt in the body, and it'll make you feel better. You get those endorphins and kephalins that make us feel better. Eat good food. Eat less, eat more fruits, more vegetables, less fried foods, less bad foods, less fast foods. 8 hours of sleep. So many things keep us from getting a good night's sleep. If you're not getting a good night's sleep, figure out why. Talk to your doctor about it. A good night's sleep will make you healthier and happier. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Laugh a lot, have fun, enjoy your life, and you really will stay healthier.